This adjustment is a supine index distal clavicle for an S to I glide restriction of the AC joint. This adjustment looks almost identical to the S to I glide restriction index adjustment that we did on the proximal humerus for the GH joint. We've just moved proximal a little bit on the body here. So again, we're at the head of the table. I cradle my patient's arm still here just because if I've got their arm, I can tell if they're relaxed or not. And if my patient is nice and relaxed, I know there's no tension up through that shoulder joint. What we need to do is we've got to palpate that distal clavicle. So we'll palpate that distal clavicle all the way out. We'll use an index contact, establish that index contact, and then I'm going to have that nice relaxed arm here, and then I'm going to add an impulse straight S to I on that distal clavicle. So I'm wanting to induce or correct for an S to I glide restriction that I felt during palpation. Here I've palpated that distal clavicle, I've got my index contact, a nice relaxed shoulder, and then a straight S to I glide impulse. So this adjustment is a supine index distal clavicle for an S to I glide restriction of the AC joint.